So your surgery is behind you, but we still need to make certain there isn't a single hidden cancer cell in your body. And to do that, you may need additional therapies, also called adjuvant therapies, that are tailored just for you to provide you with the very best possible outcome. Now, you often hear chemo and radiation mentioned together, but these are separate and very different treatments. Some women need chemo, some radiation, and some need both. If you need both types of treatment, chemo usually comes before radiation. But if you only need radiation therapy, that can begin as soon as you've made progress healing from surgery, usually within 4 to 8 weeks. So let's talk about radiation. Radiation treatment uses an invisible beam of high-energy X-rays aimed at just the part of your body at greatest risk of hidden cancer cells, usually the breast, chest wall, armpit, or next to your collarbone. The way in which your treatment is designed depends on your diagnosis and is highly specialized just for you. When you meet with your radiation oncologist or rad-onc, you'll be hearing about the schedule of treatment and discuss what side effects can be expected. There are many different recipes for radiation therapy, but most breast cancer treatment schedules last from 3 to 6 weeks with treatments each weekday. Before you actually begin radiation treatment, there are a number of steps to go through, including another CAT scan, a CT simulation. Why another CAT scan? Well, this one's different. It's not about diagnosing a problem. Rather, it obtains the information needed to create a three-dimensional model of you in the computer system that will be used to design your customized radiation plan. A radiation therapist will perform your CT simulation in the radiation oncology department. The first step is positioning you for treatment, lying on your back, reclined on an angled breastboard with a customized support mold and your arms overhead so that you'll be comfortable, stable, and in the same position each day. The therapist will obtain a CT scan of you in the position, then place some marks on your skin that correspond with targeting laser lights. That's it. It's not scary, and it's not painful. You then go home from your CT sim, and your radiation oncologist gets to work, defining the target volume needing treatment and the nearby healthy tissues to be protected from radiation, including your lungs and your heart. Dosimetrists and physicists, specialist members of the rad-onc team, refine the plan and prepare it for accurate delivery by the linear accelerator, or LINAC. It's technical, and it's very precise work behind the scenes, but it's all just for you. Once your plan's ready, you'll be called with a start date and time and told how many treatments you'll need. Normally, treatments are given every weekday, and you'll have the weekends off to help your body recover. The total number of treatments depends on your situation, so your doctor will give you an outline of the treatment plan. If you don't get an outline, ask for one. You need to understand what's going to happen. Before each treatment, your radiation therapist helps position you in the treatment room exactly the way you were during the CT simulation, using the same breastboard and support mold. So the treatment your doctor designed will be delivered accurately and comfortably. The alignment lasers are used to position you very carefully before the therapist leaves the room. It's natural that you have some anxiety regarding your radiation treatments. You've never been through this before, and honestly, we all know that radiation can be a little bit dangerous, but please understand and remember, this radiation plan was designed to benefit you and is being delivered with great care. During the treatments, the therapist can see and can hear you. All you have to do is lie still and try to relax. Your radiation therapists are wonderful, caring professionals. They do this all the time, so don't be afraid to talk with them and let them put you at ease. Once out of the room, your therapist may use an X-ray image or even a cone beam CT scan to confirm that your alignment is perfect. Image-guided radiation therapy, IGRT, is one of the latest improvements in maximizing radiation benefits while minimizing side effects. Your radiation oncologist checks these images and communicates with the therapist every day to confirm your treatments are being delivered exactly as they were designed. If your physician is using respiratory timing for your radiation, listen carefully to the therapist's instructions. We don't normally pay too much attention to our breathing, so it can be challenging to breathe a particular way or even to hold your breath. This will get easier with each one of your treatments. Under computer control, the LINAC shapes the beams and rotates its direction to send the healing rays exactly where they need to go. You can't feel the beam, and honestly, you wouldn't even know the machine was on except for you hear it humming. Each treatment takes only a few minutes. You're likely to spend more time driving to and from your treatments than in the radiation oncology department. In fact, fatigue from keeping daily appointments can be one of the most challenging parts of the therapy. There aren't any specific activities that radiation prevents you from doing. Many women drive and work, exercise, and basically live their lives to the fullest while receiving daily treatments. Now, all treatments have side effects, but those of radiation therapy are a bit different. Unlike chemotherapy, radiation is a localized therapy. The beam is directed to the part of your body most likely to contain microscopic cancer cells: your breast, your chest wall, and the lymph nodes in your armpit, or above your collarbone. The treatment area, defined by your rad-onc, is the only area where the radiation can benefit you. But it's also the only place where you can get side effects, because, like surgery, radiation treats part of your body and leaves the rest of it alone. The radiation causes damage to the DNA of cancer cells and kills them. Healthy cells repair themselves before your next treatment. That's why we divide the treatment into many daily doses, to spare healthy cells while killing hidden cancer cells. Mission accomplished. During treatment, your radiation oncologist will sit down with you for a face-to-face visit at least once a week. Here's your opportunity to ask questions and voice concerns. Even though you don't take any of the radiation with you out of the room, no, you're not radioactive, the skin of your treatment area may become a bit red, like a sunburn, towards the end of your treatment, and there's a possibility of developing a bit of peeling, especially in skin folds. This is perfectly normal, as breast cells are present just below the skin, meaning your skin is actually part of your target volume. Your radiation therapist, nurse, and a radiation oncologist can help you with recommendations to keep your skin healthy through treatments. Often they have samples of creams and ointments, so just be sure and ask. Some women experience fatigue with radiation, but if you just completed chemotherapy, you might find that you're actually a bit more energized day to day. Everybody's experience is different. Try not to miss radiation treatments, but if you just can't make it, let the department know and they'll adjust your schedule. However, it's important to avoid interruptions in treatment if you can. Think of it as a long race. You don't want to stop partway through and give your opponent, the cancer, chance to rest and recover. Even if you're having side effects, come to the center and ask for help. The best advice I can give is to put on your blinders and plow through it. Finish what you start. Momentum is your best friend. And as an aside, you'll meet the same people at your treatments every day. You'll make friends and find you care for these people and they really care for you too. There's a kind of camaraderie, an understanding amongst us, almost like a support system. It's not the club you wanted to join, I know, but the people in the club can be wonderful, and they can be lifelong friends. This app can help you too with their contact information and in sharing information from Fighting Cancer Network that might help them as well. Radiation technology has really improved in recent years, so your treatment is more tailored and more accurate than ever before. This gives both better cancer control and less side effects. At Fighting Cancer Network, we're so glad to give you good news about the great options your doctors have to help you fight cancer.